Hey guys, welcome back to our YouTube channel Rick Megha. Myself, Upasona Panday, second professional MBBS student from NRS. In this video, we are going to discuss about the explain whys from our thorax. The first question reads that the right lung is more prone to aspiration pneumonia. Why? Let's look at this diagram. This is our trachea. This is our right bronchi and this is our left bronchi. We can see that the right bronchi is more vertical than the left one. Why? Because the trachea bifurcates to the right, giving rise to a vertical right bronchi and a more oblique left bronchi. Moreover, the right bronchi is wider. Why? Because the right lung is more voluminous than the left one. Why left lung is less voluminous? Because there is a big cardiac notch which decreases the volume of the left lung. So the first point is that the trachea bifurcates to the right, giving rise to a more vertical right bronchi. Moreover, the right bronchi is wider to supply the voluminous right lung. As a result, whenever this microorganism enter our trachea, it is very easy for them to go to the right trachea to the right lung. Hence, the right lung is more prone to aspiration pneumonia. Okay. Now, the next question is that fibrous pericardium is fused with the central tendon of the diaphragm. Because this fibrous pericardium as well as the central tendon of the diaphragm both develops from the septum transversum, which is the unfused part of the cephalic most part of your splagnopleural mesoderm and the somatopleuric mesoderm. So, being derived from the same origin, that is septum transversum, the fibrous pericardium and the central tendon of the diaphragm are fused with each other. Now, the next question reads that second intercostal nerve is an atypical type. Why? Before finding the answer to why, we need to know what is atypical type. Atypical type means the intercostal nerve is not only bound to its intercostal space, but also it supplies to some other regions of the body. Now, why this second one? Because the lateral cutaneous branch of the second intercostal nerve continues as the intercostobrachial nerve of the arm, which supplies the medial side of your upper arm and your armpit. That's why the second intercostal nerve is an atypical nerve. Okay. Now the next question is the recurrent laryngeal nerve is both side present different chords. This question has been discussed in your head neck portion. So I'm not going into this question. Let's go to the next one. Central tendon of the thoraco-abdominal diaphragm is blended with the basal part of the fibrous pericardium. This is the same question as this because both develops from the septum transversum. So the next question reads, type of respiration in children is abdominal, whereas it is thoraco-abdominal in adult. Let's look at this diagram. This is the rib cage of a young children and this is the rib cage of an adult. Now, what is the basic difference? The basic difference lies in that whenever we are to show the anatomical position of the rib, we always show it like this, in which the anterior end faces down and the posterior end faces up. Now imagine breathing in. So whenever you breathe in, the anterior part of your rib goes up. What happens as a result? That the area of the thoracic cavity increases. Okay, and this is the bucket handle mechanism of your ribs. But wait, in case of children, the ribs are already lying in the horizontal position. So the rib cage already assumes its maximum transverse diameter. So whenever the children breathes in, there is no chance of increasing in the area of your rib cage. Okay, so whatever the child does, the respiration will never be thoracic. What will happen? Your diaphragm will contract and the volume will increase and air will rush in. But in case of adults, along with the diaphragm, your ribs will also assume the horizontal position that will further increase the volume of your lungs. Okay. Now, the next question is that segment 2 and segment 6 of the lung are the sites of lung abscess. So let's look at this diagram. So these are the 4 sections from your 2 lungs. This is your segment 2, segment 6, segment 2, segment 6, segment 2, segment 6, segment 2 and segment 6. So what we find is that these 2 segments always lies together. Okay. The segment 2 is the posterior segment of your upper lobe and the segment 6 is the apical segment of your lower lobe. These are the most dependent part in your recumbent position. Whenever the patient lies in the recumbent position, the lung abscess or whatever is aspirated accumulates at this site. And now wait, what is its clinical importance? It is that now the patient is asked to lie in prone position and these regions are connected with the bronchi. So whatever is aspirated or whatever is accumulated as the lung abscess will pass through your bronchi to your trachea, where the cough reflex will be initiated and the foreign particles will be thrown out of your body via the cough. So this segment 2 and segment 6 are the most dependent part of your lungs and the sites of lung abscess and also provides measure to drain that abscess. Okay. Now, the next question is that intercostal nerves other than 3rd to 6th are atypical. So I have already said that. What is the atypical nerve? Now, this is the nerve. This is the intercostal nerve which not only lies in your thoracic cavity, but it goes to other sides and supply there. So this 3rd to 6th intercostal nerves, these are the typical ones because these nerves lie only in your intercostal space. But first thoracic nerve, that is T1. What is that? Major portion of the ventral rami of T1 joins with C8 to form the lower trunk of your brachial plexus. So T1 is gone. Now T2, I have already said that it continues as the intercostobrachial nerve of your upper arm. Okay. And the intercostal nerves from T7 are present on your anterior abdominal wall and provides the cutaneous sensation of your anterior abdominal wall. So this T1 and T2 goes to your upper arm and T7 to T12 go to your anterior abdominal wall. Okay. So these are your atypical intercostal nerves. Now the next question is that type of respiration in infants is abdominal, whereas the thoracic in pregnant females and thoraco-abdominal in adult male. I have already said about why this is abdominal in case of infants and why this is thoraco-abdominal in case of adult male. Now what is only left? Now this is thoracic in case of pregnant female. Why? Because in case of pregnant female, the space of the abdominal cavity is already occupied by the growing baby, by the growing fetus. As a result, the diaphragm cannot contract to increase the vertical volume of your rib cage. As a result, only the movement of the ribs direct your inspiration. That's why the type of respiration in infants is abdominal, whereas thoracic in pregnant female and thoraco-abdominal in case of adult male. Okay. Now the next question is again the same, right recurrent laryngeal nerve. So this is done. So we are done with the explain wise from our thorax. If you like the video, hit the like button. If you're new to our channel, subscribe to our channel. All the best for your upcoming exam. Take care. Bye.